This is Laniel Mitchell from Revolution Physical Therapy in Cranberry Township, Pennsylvania. I'm here today to talk about ACL injuries. Primarily, the reason why we're here to talk about it is because girls tear their ACLs 10 times more than boys. When I was at Cincinnati, the University of Cincinnati, my main focus, my research there, was to figure out how women tore their ACLs and how we could prevent it, because this was happening way too much. My mentor, Bob Mangine, who's one of the ACL gurus, basically was the pioneer in figuring out all of these things today that we're doing for ACL injury prevention and the rehab process as well. Well, the interesting thing is, now that I'm out in the real world, which Cincinnati was kind of like this fantasy land where everything was perfect, now we're out here in the real world and girls are still tearing their ACLs. The problem is that we have all of this information on how to intervene, how to screen them appropriately, and exactly what we need to do to try to prevent these. And the worst part of it is the programs work. It just happens to be that nobody's really doing it. And right now, we're seeing almost an epidemic level of these. We're seeing up to 17,000 ACL tears a year. And it's just way too much. It's a big problem that's not being addressed. So one of the missions of our company, the Revolution, is to try to help stop this from happening. Girls need more training than boys. When they hit puberty, their body changes in many different types of ways. And from an athletic standpoint, it makes them more at risk for injuries, especially if they play sports like basketball, soccer, volleyball, where they're doing a lot of cutting and jumping and running. It puts extra stress at the knee versus something that you would do that would be something like rowing or another sport like swimming that's totally non-impact. There's been a lot of controversy over why ACL injuries happen. And you basically have two different types of ACL tears. You have one that's a contact injury, which is, you jump off the roof or somebody slide tackles you and hits your knee. Or on the other hand, you have non-contact injuries, which non-contact injuries are probably the biggest thing that we need to look at in terms of prevention, because they're very preventable. It means that somebody's running down the field and they cut or they change direction or they jump and land on one leg, usually on one leg, sometimes it's two, and something's not moving correctly, and the ACL gives out. It can happen to a lot of different types of injuries as well, these two classifications. But for ACLs, 80% of them or more in girls are non-contact, which means that it has a biomechanical causality, basically meaning that something, when they're moving dynamically in space, they're running along and they cut and boom, something gives out. That means that something wasn't working appropriately from the beginning. Well, what that means is that we can screen for that. And all of the, basically the research and the testing that has been done and the screenings that have been done have shown that it lowers the incidence and the prevalence of these injuries in girls. So what happens is they're running along, and girls, for some reason, we don't know exactly, part of it has to do with puberty, and this is, we see differences between when they're moving from being children to actually becoming adolescents. Their body mechanics change, and what starts to happen is that their knee starts to collapse in, and it's a compensation for what we think is typically an issue with strength and control at their hip. Because I'm the ACL expert these days, I have to see a lot of these people and these girls after their injuries. But what happens is I go out and talk to the coaches and talk to people, and nobody seems that interested for some reason until after the bad thing happens. That's our society. It's something that needs to change. We need to get more into a preventative role. And part of the prevention is the training. So not only do we take the chance of preventing this injury, we're also enhancing the girls' performance in their sports. If their biomechanics are off, they're at risk for injury, how can they be their best in sports? And this is the main problem. Ever since we moved and changed directions with Title IX, allowing all of this inclusion, which I believe is great, girls have really been underserved up until this point because they're not the same as boys. They need a different type of training than boys. Once they hit puberty, their biomechanics change, and a boy's biomechanics stays the same, and they're at less risk for injuries. The girls are at higher risk, so we should be intervening and doing something, not only at the coaching level, but at the medical level as well. This information is out there, the screening is available, and we're going to offer it now because it's really our moral and ethical obligation to society to take care of these girls and make sure that they're getting the care that they need.